Okay, so we're gonna go over soft tissue and how soft tissue dysfunction causes headaches. And most headaches, like 46% of all primary headaches come from neck tension. And so the soft tissues that are involved in headaches are typically in the neck and the shoulders. And so I'm gonna show people where all those are typically on average patients that come in the office. So if you'll just rotate your head to the right for me. So one of the most common places for a trigger point or a spasm that causes headaches is going to be right here. And this is the C1 vertebra and the occiput where they meet together. This is called the upper cervical joint. And there is a grouping of muscles in here that make up the suboccipital triangle. It's a grouping of 3 muscles. And these muscles, when tight, when there's a trigger point or spasm in here, can refer pain into the head and cause a headache. A lot of times when you press in these muscles, people who have headaches will feel a radiation that kind of goes up the back of the neck and into the head by just pressing right here. So that's a good way to check, if that's something that's going on with you. Another one that's a little bit less common is about midway through the neck right here. There can be some as well that cause that. And this is in the erector group of the neck muscles. And then even more less common is in this SCM muscle. If you'll just rotate your head to the right into my hand, you see it pop out right there? That's the SCM muscle. Sometimes we'll see some in here as well. And then the next biggest location after the base of the skull is going to be in the traps. And usually the trap one is dead center, like halfway between the two, right here. Sometimes it's out here. And so any of these that you or somebody else presses on, if you get a radiation that mimics the kind of pain that you have when you have a headache, then you know this is something that's causing your headache condition, and it's something that needs to be treated.